Hi, good morning all. So before we start my talk and before I introduce myself, may I request you all to do something for me. Please stand up from your respective position and sit back. Thank you so much. So we all could see most of you did that without second thinking, without a pain, isn't it? But for more than 350 million population on this planet, so this simple act could be the beginning of a suffering. Hi, I'm Dr. Raghu Nagaraj. I'm an orthopedic surgeon practicing from past 20 years. I have reconstructed thousands of knees that were torn on football pitches and many other sports. And I've replaced many joints that were ground down to bare bone. And I've used robots equipped with AI to precision more accurate than human hands could achieve alone. I've done all that. But today, I'm standing here in front of you all to confess something. For the first 10 years of my career, I was answering the wrong question. See, patients came to me broken, I fixed them, and they left grateful and was happy. So this kept repeating. But somewhere between surgery number 5000 or 5000 and odd, a small thought started haunting me in my scrub room. That is, what if all these patients never had to reach the operation table at all? So that thought stayed with me over time, and it changed the way I look at my case when they walked in. I didn't see them not just as a case, but I started seeing them as a story in progress. So this conference asked us to design the world with better stories. So I'm here to tell you all that the most powerful story in medicine is the one that ends before the operating table. So let me share some of the stories with you. So story number one, body that doesn't forget strength. So this story about a person who is 30-year-old guy, gym trainer by profession. Most of his days was spent in training and making people fitter and happier, making them more comfortable and confident in their own bodies. But one unfortunate day, he met with a road traffic accident, so terrible injury to the knee and ankle. So that made his life come to a standstill. For 3 years of his life, his knee stopped moving because of the multiple surgeries that was conducted at a remote place in Karnataka. So his knee ended up becoming fused to each other, and so is the ankle at exactly 90 degrees. So forget about walking, is even standing on his foot was barely possible. So when he came to me, his knee not only was injured, but it stopped moving completely for 3 years. I still remember what he said when he came to me. He didn't ask me, will I be ever same again? But instead he asked me, will I be able to stand? So that thought stayed with me in my mind. Because at that moment, it was not just about surgery. It was about giving someone back a part of themselves. Of course, the surgery was complicated because multiple injuries, multiple surgeries, bone was fused, and previous surgeries had left his skin condition in a poor state. So that made the surgery a little complicated, but the present technology of robotics and the surgical expertise and experience made sure that the surgery was successful. Of course, he now, with his present recovery period, he's got back to his walking and now he's back to training rest of the people and is now leading a happy life. So whenever I think about him, I'm remembered that body doesn't forget strength. All it needs sometime is just a little help to find it back again. So story number two. So this is about a patient who is a 72-year-old guy who never let his age define his story. He loves his bikes, loves his long rides, and that had become his identity. It had become his freedom. But again, one unfaithful day, he met with an accident and the knee was terribly injured. He tore three of his four major ligaments of his knee joint. So again, walking was difficult. So naturally, people around him started thinking if this is the time for him to slow down again. But again, when he came to me, when he sat across to me in my clinic, he never spoke about slowing down again. All he asked us, when can I start riding again? Again, the surgery was complex because we had to reconstruct three out of four ligaments, and poor tissue quality due to age, but again went successful. So what I remember was not just the surgery. The surgery is just a beginning of the story. What I remember is what stood up, that what came after is discipline, is consistency, and his belief that he would get there. Step by step, he did. He reached that stage. And after a few months, when he came back to my clinic, he told that word, Doctor, I rode again. And that one word said more than what any other report could ever tell me. So this story reminds us that healing is not just getting back to walking again. It's getting back to the life that will make you feel alive. Story number three. This is an interesting story I'll never forget. So this is about a mother and her son. So both had come to me at the same time. standing at that moment, standing at the same place, ready to move forward. Mother was in her 70s, her life lived well, years of use of joints, our Indian Karnataka women, they sit and they do all sort of activities. So she had used her life very well. So that's what resulted in the natural degenerative arthritis of her knee, which is a story that we generally see often in our clinical practice. But the son is still younger, 40, late 40s or early 50s. So that shows that his lifestyle had quietly caught up with him. And also that depicts the present trend of developing early arthritis in a young age due to poor lifestyle, sedentary habits, and most importantly, the stressful working environment. So what interesting about this surgery is not the condition, is the decision to go forward together. Same hospital, same time, same surgeon, and the same goal, ready to get back to normal life. So they both underwent knee replacement, robotic knee replacement at the same time. So when I saw them during the recovery period, I didn't see them as just patients alone. I saw them as a team, encouraging each other, recovering together, and taking their step first time side by side. So that again tells us a story that healing is easier when you don't do it alone. Fact is, these stories are not rare. They're happening every day in India. In India alone, more than 2.5 lakh knee replacements are happening every year. And that number has increased more than 2.5 times in the past 5 years. So think of that. They are not just numbers. There are lakhs of people whose lives have been slowly changing over a period of years, isn't it? And it's not just something has gone wrong on one fine day. It is slowly, the problem has been building up for years together. Yes, the knee procedures demand is increasing rapidly and is expected to be grow at a fastest pace in the world. And again, that brings me back to the same question, what all of these patients had never had to reach the operation theater at all. So this is the story that's together. These are the things, the 2.5 lakh people who undergo knee replacement every day. And not just the knee replacement, alongside this, thousands more undergo ligament surgeries like ACL surgeries, meniscus surgeries, and the various cartilage knee preservation surgeries, and so on and so forth every year. So that brings me to the question that how to prevent that. So what one can do so that we can bring down these numbers who are getting towards the operation theater. What can we do about them? So this is what I want to talk on, that AI driven assessment sensors. So this is a sensors using which one can assess how the knee is functioning. So how does this look like? Just imagine how you get your health checkup done. Most of you go for blood test, most of you go for ECG, you check your liver function test, you check your kidney function test. But have you ever got your knee assessment done? See, that's what it is about. In just 40 minutes of a non-invasive assessment using these AI sensors, one can now analyze how your weight is distributed on both your limbs and how strong, stable and your muscles are, and how your movements in a real-time motion, and is there any poor muscle mechanics going wrong in the movements. So all these data is put into AI platform, which gives us a simple knee health score, a score which tells you where you stand today and what your future risk looks like. So this helps us to control the problems even before it is seen in a clinical practice. So that's the health score. So it's not based on guesswork, it's not based on averages, it is exact objective data that helps us to know where the athlete or a particular person stands in particular thing. So how a blood test gives insights about your internal health. So this score gives us an insight into your movement health. So that what brings in the evolution. The technology starts beginning to change everything. So this will give us a comprehensive analysis about your strength, about your proprioception, how your mind knows where your joint position is, what we call as a proprioception, as the most important aspect to prevent injuries. So all this data put together gives us a clear detail to bring down the number of surgeries, to bring down the injuries. And sometimes surgery does become necessary when they reach the last stage. Even that story is changing too, because using a AI-driven robotic assessment like Mako and many others, we are not only able to see during the surgery, but we are able, even before the procedure begins, using a 3D anatomy of the map, using a CT scan, we are now able to clearly see the knee in detail even before the surgery begins. So how does that help? That helps us to clear the map, the anatomy of the patients, to know how their precise alignment of their leg is, and to know the size and position of the implant that's going to go inside, and how natural the knee is going to feel when they get back to the recovery period. So all these things are the advantages of robotic system. And robotic system enhances precision. It doesn't replace surgeons. It enhances our precision, our skills to get the better transformative outcome for our patients. And also, it's very, very safe. There is a myth among the patients that robotic comes by themselves, operate on the patients, and what if the machine goes wrong? Like, our minds that, what can go wrong, and what if it's not under our control? What if it becomes totally independent and wild enough, right? No, it's very safe, because this is what we call an haptic boundary, because every movement during the surgery moves in a predetermined safe zone down to sub-millimeter accuracy. It's totally under control. It doesn't operate. It just enhances our expertise. And also during the surgery, it gives us a real-time ligamentous balancing, because when we align the ligament on both the sides, the inner and the outer knee, the front and the back part of the knee aligned equally, then we get a more natural knee, a knee replacement which is not just successful but also very natural. A natural, and how exactly the body is designed to function. So it's more personalized to the particular individual. It's not just based on averages. It's not just one implant being fit to everybody. Now it's all customized, because of the before surgery we can get to know everything about that particular patient. That's what makes this knee robotic surgery highly transformative and successful. But what excites me even more is not just the surgery, but a possibility of leading less surgery. That means a rehabilitation. So this is AI driven assessment and rehabilitation. Just imagine, what if you get to know how well the knee function is, how the muscles are strong. If you can get to know that, you are able to work on it, isn't it? So this AI driven assessment adapts us to the particular patient in a real time. So it gets to know exactly what the muscle strength they have, and how much force they can produce that, and where things are going wrong. It gives us a real-time information about, it helps us to identify a subtle imbalance in the muscles, poor movement mechanics, and a compensation that's being loading the joint over day, over years basically. So all these things will get us a real-time data, which will help us to control the problem much earlier in the timeline. So we are moving from reaction to pain towards understanding its cause, from reacting to injury to optimizing the movement. So now we know in a much better way how the body functions, how the knee moves, how the muscles work. Everything we have a detailed information. So this is not just numbers and not just an idea. The data is already pointing towards that particular direction, because study shows that in sports injury and prevention program, whenever we apply this program, that is neuromuscular training and movement control and all these optimizing the strength and movements, shows us that injuries can be prevented up to 50 to 60%. And also among elite athletes, this particular program, whenever we adapt to them, they are able to prevent re-injury rates by almost 50%. And also this research suggests that there's a significant reduction in the rate of joint degeneration and progressing towards arthritis in a general population, not just in sports, but also in general population. And that helps us a lot in a big way, because a general population, what makes our numbers more? They are the one who comes for more and more knee replacement, more and more injuries. So if we can put it across to the general population, help them to bring down their injuries. If all population in the world starts thinking towards a prevention program, but it's getting their knee analyzed, know what's going wrong and what to work on, then and this AI assessment also helps us to build a precise data driven rehabilitation program, so which helps us to control the injuries and helps us to prevent them from going back to the operation theater. So to conclude, I want us to bring us a shift from reacting pain towards understanding its cause, from reacting to injury to optimizing the movement, and also believe that medicine truly evolves not just when we get better at fixing them, but when we get better at avoiding them. Because in medicine, I truly believe the most powerful surgery is the one where we never had to do any surgery. And the most powerful stories for any patient is when they never had to become one. Thank you.